On the afternoon of July 16, 2003 in California, George Weller, age 86, hit one car, then plowed through a busy marketplace crowd going speeds of 40 to 60 miles per hour. The entire collision only took 10 seconds. By the time his car stopped, 10 people had been killed and 63 were injured. In June of 2011, a 90-year-old woman plowed her car through a San Jose nursing home's rec room when she mistook the gas pedal for the brake. 2 residents died. In February of 2014, an elderly driver in Florida killed 3 people and seriously injured 4 others when she accidentally put her car in reverse while trying to park. Car crashes rank among the leading causes of death in the United States. The CDC states that the risk of being injured or killed increases as you age. In 2012, more than 5,000 older adults were killed, and more than 200,000 were injured in automobile accidents. That was a 34% increase from 1999. Fatal crash rates increased substantially starting at age 70, but the highest among drivers 85 and older. According to the Insurance Institute for Highway Safety, the rates of accidents and fatal crashes per mile surpasses the level of the youngest, most accident-prone drivers. Drivers over 85 have the highest rate of fatal accidents compared to any age group. There have been many attempts to stiffen driver's license renewal requirements based on age, but they have failed. Organizations representing the elderly, such as AARP, claim that this is age discrimination, or that it's too expensive or just unnecessary at all. At this point, Illinois is the only state that requires older drivers to take road tests. The state also makes renewals more frequent as people age, and once a driver reaches 87, they must renew their license each year. Another part of the problem is that it only gets worse as the number of Americans over 70 is expected to rise. It is projected by the year 2030, the number of older drivers will be more than doubled. AAA noted that 10,000 Americans a day turning 65 and an increased number of families will be faced with the challenging of balancing safety and mobility in their home and family members. AAA urges families to prepare now before they get their wake-up call. Drivers' abilities are greatly affected by age-related declines in their vision and overall physical changes. AAA's Director of Safety, Jake Nelson, states, while safe driving is a function of ability and not just age, older drivers and their families need to be mindful as the body ages, medical conditions including visual and cognitive impairments become more prevalent. It is critical to understand how these changes can affect a person's ability to drive safely. The CDC states that this problem is further compounded by the fact that the elderly are much more susceptible to injury and medical complications, rather than an increased tendency to get into accidents. One very dangerous phenomenon among elderly drivers is pedal error. One such example is when an 80-year-old driver slammed her SUV into a gym in Livermore, California, killing a woman inside. AAA studies have shown that pedal error applications, where a driver mistook the accelerator for the brake, occurs over 16,000 times in a year in the U.S., or an average of 44 accidents a day. This results in 500 deaths annually. An auto forensic specialist from Berkeley noted that older drivers whose reflexes have begun to deteriorate are particularly prone to hitting the wrong pedal. He states they are not even aware in the moment that they are thinking that they're hitting the brake pedal when they're actually tapping the accelerator. There are protective factors, automobile safety measures, and even proposed legislation that could certainly help improve drivers' safety as well as our society. Some individual protective measures would benefit all drivers, and this includes the following 7 steps. The use of safety belts. According to the Centers for Disease, or the CDC, statistics show that 3 out of 4 elderly accidents where victims were wearing their seat belts, which decreased the number of fatalities. Awareness of driving conditions. The elderly should limit their driving in bad weather at night. This proved to decrease the number of accidents. Lessen paradriving is step number 3. The CDC stated only 7% of older drivers involved in fatal crashes had a high blood alcohol concentration compared to 24% of drivers 21 to 64. Step 4 is increase exercising to improve overall strength and flexibility. Step 5 was discussions with healthcare providers to review medications and their side effects, along with regular eye tests. Step 6 is to plan their trip ahead of time, utilizing the safest route and their easiest parking. Finally, step 7 is to avoid distractions such as eating, phone use, and also loud music in the car. It is important for each citizen to do their part in staying safe on the roads, but automobile manufacturers can also assist with this. The National Highway Traffic Safety Administration stated the top 10 automobile companies are committed to making automatic emergency braking a standard and feature in cars. This new technology using cameras, lasers, and radars would alert drivers of imminent crashes and apply the brakes automatically for them. Some legislation has been created which advocates for stores to create barriers in parking lots for companies who add these protections. This bill was created after an elderly woman drove her car into a Sacramento daycare. Thankfully, no one was seriously injured. The latest research from YouGov shows that most Americans, 62%, support requiring older drivers to retake their road test each year. I have a graph here. Now we can get it on the camera. Do you favor or oppose requiring drivers older than 74 to take their written and driving tests in order to retain their license? And I also have it for everybody if they need it. We can pass it out after. There. Predictably, the older you get, the less likely you are to support the road test for the elderly, as the graph indicates. I propose the following policy change in South Carolina. South Carolina should require all drivers ages 70 and over to pass their vision and road tests each year in order to get their license renewed. I ask that you contact the following legislators who represent South Carolina to recommend this change. U.S. Senators Lindsey Graham and Tim Scott, U.S. Representative Tom Rice, South Carolina Senate District 33 Luke Rankin. And in conclusion, I believe we should all voice our concerns for the health and well-being of not only the elderly in the state, but for all U.S. citizens. We can make a positive impact in our society. Thank you. Any questions?
Why is Illinois the only state requiring drivers to take the road test?
That's mostly because of age. A lot of people think it's age discrimination, and that it's just not necessary at all to make the law. So, any other questions?
What is the reason for the increase in accidents as people get older?
It's because of age-related declines in cognitive reasoning, and also their vision goes bad, as well as overall physical changes. Any other questions?